Assalamualaikum warahmatullahi wabarakatuh. Hey everyone, today I will present a journal entitled Food Sanitation and Hygiene Practice in the Food Purchasing during the early period of COVID-19 pandemic in Greater Jakarta, Indonesia, an online study. Previously, let me introduce myself. My name is Anesa Dela Melasari and my number study is 41. Introduction: Coronavirus Disease 2019. COVID-19 is an infectious disease caused by SARS-CoV-2. COVID-19 is transmitted from people with symptoms to other people through droplets and can also be through objects and surfaces that have been contaminated by droplets from infected people. The COVID-19 pandemic has had a huge impact on all aspects of life, including food purchasing behavior. Several studies have found that the COVID-19 pandemic has increased online food purchasing or delivery. Consumer behavior survey in Southeast Asian countries show that the level of awareness among Indonesian people regarding COVID-19 is lower than people in other countries in Southeast Asia, 23% versus 40%. Activities related to food fulfillment are still the same both before and during the COVID-19 pandemic. During this pandemic, changes in behavior in meeting food needs are also related to other important issues, especially food safety. To ensure food safety, all personnel in the food chain are responsible for guarding against food threats, whether originating from raw food materials, machines, facility, production processes, or individual. The World Health Organization has released 5 guidelines from safer food: proper cleaning, separating raw foods, cooking properly, keeping food at a safe temperature, and using safe water and raw materials. This research aims to identify a description of food hygiene and sanitation practice as part of the food safety aspect in food purchasing practice in Jabodetabek, Indonesia. Methods: this study was observational study with a cross-sectional study designed in Greater Jakarta, Indonesia. DKI Jakarta Province and its satellite cities or agency make up Greater Jakarta. In this region, the number of COVID-19 deaths and probable COVID-19 deaths was higher than in other parts of Indonesia. In this study, the questionnaire was tested to assess its validity and reliability on a total of 30 respondents in April 2020. In the first week of May 2020, data was collected using a Google form distributed through social media, WhatsApp, Facebook, Instagram. The number of samples in the study was 411 respondents with a sample selection using non-probability samplings. The questionnaire was delivered in Bahasa Indonesia, which consisted of 37 questions and was divided into 4 sections. The first section collects demographic information containing questions related to residence, age, gender, marital status, education, type of work, and family income during the past month. Then, the second part of knowledge proxy relates to COVID-19, which consists of 8 questions. These 8 questions are related to general knowledge of COVID-19, transmission mode, symptoms, factors that aggravate and prevent COVID-19. The assessment was based on the number of correct and incorrect question answered, with a score of 1 for each correct answer. Categorization was carried out using the 70 years percentile cut-off score. The third section, which consists of 20 questions, is all about hygiene and sanitation practice. This section dealt with 3 subthemes: food purchase description, food sanitation hygiene practice, and COVID-19 related information source. Assessment of food hygiene and sanitation practice was carried out using a composite index based on a combination of 9 main variables. The research instrument had previously been tested and reached the Cronbach's alpha value of 0.667, which indicates an acceptable on its internal consistency. Data were analyzed unvariately, bivariately, and multivariately using statistical software. Multivariate analysis was performed using a logistic regression test. Discussion. The result of the descriptive analysis showed that the percentage of respondents who had adequate sanitation and food hygiene practice during the pandemic was quite low regarding the behavior of washing hands with a soap. Although the majority of the respondents answered to always practice it were quite high, more than 90%. Not all of them practice it. Apart from that, this is only based on respondent confession without any evaluation of whether the practice of washing hands with a soap is sufficient or not. Regarding practices related to food safety, most respondents have carried out special treatment when purchasing ready-to-eat food, such as disinfecting food packaging or reheating. Meanwhile, for raw food ingredients, respondents washed them with running water and food-grade soap. In storing raw food ingredients, this research found the potential for cross-contaminating due to storage on the same shelves or not being separated at all. The final thing related to respondent food sanitation hygiene practice. It's the source of information regarding food handling during the pandemic. The explanation of this relationship is closely related to changes in individual behavior and perception. From this research, it was found that the multiple sources of information regarding food handling during the pandemic had an effect on a better practice related to food safety compared to one source. This is an important finding as a health promotion strategy that supports change in a people behavior. Result: the total of respondents in this study were 411 people with an average of 33 years. The majority of respondents were female is 79.1%. Resident in the Bogor Regency and City is 35%. Married is 62.5%. With a background of tertiary education is 67.2%. Currently having a permanent type of job is 43.8%. With a family income in the past month ranging between 1 million rupiah up to 5 million rupiah is 35.5%. The proportion of respondents with a good proxy level of knowledge was around 63.3%. Some items with a low percentage of correct answer were listed as follows: the initial symptoms of COVID-19, duration of hand washing using a soap that effectively kills the COVID-19 virus, and the effective alcohol content of hand sanitizer to prevent the COVID-19 transmission. Meanwhile, the majority of respondents, 81.8%, were worried about the risk due to direct shopping during the pandemic. Besides, most of the respondents, 78.1%, were worried that the transmission of COVID-19 might happen due to the purchase of ready-to-eat meal. Conclusion: this study showed that the food sanitation hygiene practice of consumers during the COVID-19 pandemic in Indonesia are still classified as unfavorable. The determinants of the food sanitation hygiene practice of consumers include the type of non-permanent job of the respondent, the perception of concern about transmission when shopping directly, and single source on food handling during a pandemic. Meanwhile, changes in the frequency of direct shopping and online food purchasing are considered as protective factors to better food hygiene and sanitation practice, with changes in the people purchasing behavior during this pandemic. Appropriate educational strategies are needed to improve better the food sanitation hygiene practice in the community. And this is source of journal. And thank you for attention. Wassalamualaikum warahmatullahi wabarakatuh.